I'm sorry, I couldn't understand you.
Sorry. Do you think colleges, and particularly the colleges in the university system of Georgia, will be at the vaccination levels needed to resume full in-person classes come August of this year?
So you're asking about the vaccines and students going back in person?
Yes.
Well, obviously, you know, students of that age bracket don't meet the qualifications yet, nor do I. We've been in great conversations with school superintendents and others about getting the vaccine out to our teachers and professors and other people. Obviously, in those systems right now, if there's teachers that meet the criteria, school nurses, school resource officers, those over 65, they can call their health department. They have availability. They can go get the vaccine. The data that we're seeing in young people in our state is very clear. The kids should be in the classroom. There's a safe way to do that. We had a briefing this week. If anybody wants more information, we'll be glad to let Ryan Loke and Dr. Toomey's team follow up in regards to that. So I expect you're going to see a lot of kids going back into the classroom regardless of what the situation is with vaccinating their staff. However, you know, that is front and center on our mind for when we move to the next phase and have more availability. We definitely want to get our educators vaccinated along with other people that are quite honestly on the front lines of the pandemic in many different ways besides our healthcare folks. I mean, you got grocery store clerks, a lot of front-facing people, state government and other in the private sector and other things. And so we're going to continue to roll this out as quickly as we can.
Governor, a new, more contagious strain of COVID is here in the state. What you all have given some information about that. Has there been any spread of that? Do we have any more updated information about the individual and how they're doing?
Well, I don't know if Ryan wants to add anything. I mean, even before we announced that we had the first strain, I've assumed for well over a week, probably close to 2 weeks now, when Colorado had the strain, I figured we had it. You know, if it's in the middle of the country, you got to figure it's in just about every state, or it will be soon, and certainly in Georgia with the logistics network that we have, and just, you know, airports and interstates and everything else. You know, I don't know if that's a reason for our uptick that we've seen. I think for the most part it's probably just post-holiday, you know, Thanksgiving, Christmas, New Year's, all the things that we warned against. Which is why it's important, regardless of what kind of strain it is and what's happening here, we know what helps prevent and mitigate that, and that is wearing your mask, socially distancing, following the guidance and the guidelines, and just being smart about what you do and don't do.
Do we know if there's more than one case of that strain that's here?
Andy, so far we've only been able to identify one case that was that 18-year-old that was reported earlier this week. Labs, particularly the Thermo Fisher lab, if people have that equipment, have the ability to identify this specific variant, but we haven't been able to identify any other variants of this or any other of the new strains so far.
Governor, two questions. First on vaccines. We're hearing from health departments, people are saying, well, the governor says that I can get my vaccine because I'm over 65, and they are just being flooded with people right now. Why open it up to as many people as you did when we didn't have the supplies or the infrastructure to handle that demand?
What you're saying is not correct. We expanded the criteria to start on January the 11th, which we haven't gotten there yet. We also explained to people when we announced that expanded criteria that it would only be if the vaccine is available. So if you're reporting that anybody over 65 can get the vaccine, that's technically not correct. They're eligible for it if there's supply. We've been very consistent about that message, and that's why we're telling people, call your health department. I mean, look, I just said in the remarks, we have a little less than 12,000 doses a day outside of what the long-term care facilities are getting through CVS and Walgreens. And you think about a state of 10 million people with the number of sick people that we have that's 65 and older, the number of first responders, the number of other people that meet the criteria, our health care workers. even taking out long-term care residents, that's a lot of people. We do not have near the supply to deal with that. What we were simply trying to do is make sure that we didn't have vaccines sitting in freezers somewhere. And that is what we're going to continue to do. As soon as we can open up broader, I mentioned in our remarks the things that we're working on, that when we do get that supply, to have other private sector partners, the 1,000 providers that Dr. Toomey has signed up, we'll start implementing that. But we can't really do that. I mean, we have 159 health departments across the state in every single county. You take 12,000 and divide it by 159, that's not that many doses. So we're going to use every single resource that we have in this state to get this vaccine in people's arms. But we also got to have an ample supply. And look, we have things that we need to do better on our end. We need to do a better job of reporting. We need to do a better job of making sure that we're communicating with the public and answering the phones, and that the folks at the local level are getting the appointments set up, and that we're transparent with people and all that messaging. I'm committed to continuing to do that. But we also, are constrained right now by supply and our allotment that we're getting from Operation Warp Speed.
And a question on pandemic response. Since October, White House Coronavirus Task Force has been warning Georgia to step up mitigation. They did it again before Thanksgiving. They did it again before Christmas. You have not enacted any new restrictions. You said today that you encourage people to continue to wear masks and follow the guidelines. Are we not at a time with the hospitals overflowing that we need to be taking more aggressive steps?
Well, we have other states that have taken more aggressive steps, and their hospitals are overflowing too. We can deal with this virus. We can fight our way through it. I'm talking to hospital CEOs every week. Our team's talking to them. I would imagine it's safe to say every single day. I got an update on hospital capacity yesterday. I got one this morning. They are managing unbelievably. It's amazing what they're doing. It's amazing what they've learned and how they're able to treat more of these patients. But keep in mind, too, we still, statewide, our average of COVID patients in the hospital is 30%. So the reason our hospitals are full is we have 70% of the hospital that's non-COVID that is extremely busy right now with other procedures that require overnight stays, which is why we've implemented the bed capacity plan that we've had set up. We got the World Congress Center up and running. As of yesterday, I think we had 22 patients there. I think that will continue to go up to help give relief to our hospitals, and we'll continue to do everything we can to support. But right now, they are holding their own. We are augmenting staffing, and quite honestly, for the business model and the financial stability of our hospitals, they need to be doing that kind of volume. The last time we shut down, they begged me not to shut down again because they said, we'll go bankrupt. So we know how to fight through this. We need to continue to do that. If something changes, I always have an open mind.